We spend a lot of time discussing nicotine, and this is for a good reason. If you've had a consultation with us, you'll see we review an extensive list of very rare risks. It's important to know that nicotine is not one of these rare risk factors for complications. Nicotine problems are very common and very real. Nicotine users are at a significantly higher risk than non-smokers for post-surgical complications. The reason for these complications are believed to come from two aspects of nicotine use. First, the inhalation of combustible materials. Second, the nicotine itself. Some of these effects are related to long-term use, such as cardiac effects and lung effects. Some of these are more short-term and are actually potentially reversible, such as constricted blood vessels, carbon monoxide-induced decreased oxygenation in the tissue, effects on the autonomic nervous system, increased platelet aggregation, this is commonly described as thickening of the blood, and potentially impairing microvascular circulation, where these tiny blood vessels can have a huge impact by reducing blood flow by up to 40% and resulting in poor oxygenation of tissue. Through the combination of short-term and long-term effects of nicotine, it has been shown that nicotine users who undergo surgical procedures have a significantly increased risk of infection, healing problems, adverse effects with anesthesia, hospitalization, risk of skin and tissue loss with large open wounds, and overall an increased risk of perioperative death. So how do we optimize outcomes and limit these risks? Unfortunately, we're unable to quickly change the long-term effects of nicotine. What we can do is change some of the short-term nicotine effects. For this reason, we recommend 6 weeks prior to surgery and for 6 weeks after to avoid all nicotine of any source: cigarettes, patches, gums, vapes, or any other method. We actually test our patients prior to surgery to be sure they are nicotine negative because these risks are so real and can be so severe. Again, this significantly decreases perioperative risks, but does not eliminate the risks associated with chronic nicotine use. Nicotine use is a very real risk of major complications in aesthetic surgery. Although you can never eliminate these risks, you can significantly reduce these risks by perioperative nicotine cessation.